Hi! Welcome to Fairy Tiff's Journey. My name is Tiff, and if you're new here, we're talking about my journey with functional neurological disorder and everything that goes along with it. If you watched my intro video, yes, I did film both of these on the exact same day. That's why I'm wearing the exact same outfit in the exact same position. We're gonna start with my medical binder. Like, yes, my weird medical shit. I'm just gonna go over functional neurological disorder. I'm not gonna go over all of my diagnostics for it. I'm just gonna go over what it is in this video. We'll make another video, probably, because I don't know what I'm doing yet. I don't know. I'm going to film these videos, and I'm going to upload them. I don't know when I'm going to film or upload. Maybe it's all going to depend on how I feel during the week. So I'm not going to promise I'm going to film and upload on Mondays and Tuesdays. I can't make that promise, but I can promise that I will probably film and upload once a week. Let's get into what functional neurological disorder is. And I'm going to put a little disclaimer right here that I'm not a medical professional, but this is from I will put down in the description box, because that's important, where this information comes from. So the disease overview for functional neurological disorder. It's a problem with the function of the nervous system. So the nervous system is the brain, the spinal column, right? And it's a problem with how it sends and receives information. And it's not a problem with the structural system like with MS or stroke. And it can encompass a wide variety of neurological symptoms, such as limb weakness or seizures, which I have both. Yay, me, go me. Not epileptic seizures. We'll get more into my specific symptoms in the video as we go on. FND is a condition at the interface between the specialties of neurology and psychiatry. It's really cool. It's great. It is great. Conventional tests such as MRI, brain scans, and EEGs are usually normal in patients with FND. All of my stuff was normal. Everything looked normal, except for the symptomology that I was experiencing. This has led historically to the condition being relatively neglected by both clinicians, researchers. However, it is now established that FND is a common cause of disability and distress. Yeah. Distress. When your body just decides, like, your brain is fine. Your brain is going, okay, do this thing, and your body goes, no. And your brain goes, just do the thing that I know you know how to do, and your body goes, no. And your brain's like, but seriously. And your body goes, I'm going to do this other thing instead. Look at this thing that is going to do instead. It's so much fun. Yeah. Which may overlap with other problems such as chronic pain and fatigue. I don't really get the pain. So if you are experiencing chronic pain with FND, I don't experience the pain. I do get Charlie horses when I've had a lot of the muscle spasm symptoms over the course of a day when I've been overly stimulated. But I do get fatigued a lot. I do get fatigued incredibly easily. I got up this morning And I had the intention of making myself look nice so I could film for YouTube, which I did. And then I ate lunch and I took a nap. And now I'm filming several hours later in the day because I got fatigued from doing my hair and makeup. Older ideas that FND is all psychological and therefore always associated with stress and or past trauma, and the diagnosis is made only when someone has normal tests, have changed since the mid-2000s. The new understanding, which include modern neuroscientific studies, has shown that FND is not a diagnosis of exclusion. It has specific clinical features of its own and is a disorder of the nervous system functioning in which many perspectives are necessary. These vary a lot from person to person, and in some people, psychological factors are important. In others, they are not. So, functional neurological disorder has had several different names in the past. Functional neurological symptom disorder, functional movement disorder, conversion disorder, psychogenic seizures movement disorder, dissociative seizures, motor disorder, non-epileptic seizures, FND, dissociative neurological symptom disorders, signs and symptoms. So, now we're going to get into some of the symptomology that I experienced. Yay! I love this. Because I ignored most of my early symptoms for a long time. Okay, FND patients can experience a wide range and combination of symptoms that are physical, sensory, and or cognitive. Motor dysfunction, functional limb weakness, or paralysis. So, my left side of my body is basically, it's fine sometimes, but most of the time, it's just like a weight that my body is lugging along. I walk with a cane a lot. Sometimes it's perfectly fine. Sometimes I can't grab things. Sometimes it just feels like it's not there. It's an adventure every day. Functional movement disorders including tremors, spasms, dystonia, jerky movements, and problems walking. So I have drop foot. When I got admitted to the hospital finally, because I went 3 times, because I said, my left side just doesn't feel right. I know that there is something wrong. And the 3rd time I went, I was actually having seizures that they said weren't seizures, but they were seizures. I just wasn't losing consciousness. I was having spasms so badly they thought that I was having a drug overdose, and they gave me Narcan. Because all of the blood work they did, they realized, oh, the only drug in my system, because I wasn't even taking my prescribed Adderall prescription because I thought that was contributing to my symptoms, was marijuana. And in the state that I live in, I have a medical card. That was the only illegal substance in me, but I was prescribed it. I had a legal amount in my body, but they still gave me Narcan because my lactic acid was off the charts because I had so many muscle spasms in my body. So that was fun. I got Narcan, and there was no narcotics in my body. And I was shaking so much. I was having so many seizures. I still occasionally do. It's fun. It's an adventure. Yay. Functional speech symptoms including whispering speech, slurred speech, or stuttering speech. When I'm stressed especially, if I don't think about what I'm saying, or if I get too excited, I make up words. All words are made up, but I really make up words. My son had a running list of all of the words that I made up in the early days of figuring out this disease. I don't have all of the words, but one of my favorite ones was Tuesday. When I tried to say Tuesday, I said Tuesday. I don't know who Sue is, or maybe it was Dr. Seuss Day, but Tuesday. Back to the paralysis, several times, it still happens sometimes, where I will just be walking, and my legs will say, nah, we're not doing that no more. And I'll just stand there and be like, yo, guys, what are we doing, man? Can we just get moving again? Yeah. And they're like, I don't think so. And I'm like, cool. I'm not down with this, but whatever you say, buddy. 'Cause my brain wants to do one thing, but my body wants to do another. Sensory dysfunction. Ah, yes. This is how my symptoms started. Functional sensory disturbance includes altered sensation, numbness, tingling, or pain in the face, torso, or limbs. This often occurs on one side of the body. Yes. I've had numbness and tingling in my left hand for like 2 years. And my tootsies for way longer than that. I have ignored it because I'm really good at compartmentalizing and being like, oh no, yeah, it's fine. I'm middle-aged. This is something that happens to everybody, right? Oh, maybe I I held my arm in a weird position. Maybe I slept weird. No, honey. No, honey, that's not what happened. That's not what happened, honey. That's not what you did. You need to not do that. Don't ignore symptoms. Don't just go to the chiropractor and get a massage, even if it does make the symptoms go away. Functional visual symptoms, including vision loss and double vision. Okay, so the vision loss and double vision, this has been happening for a little while, and it's been at nighttime, and I just thought it was, again, age. And I even brought it up because I turned 40 and my doctor said, hey, you need to go get a mammogram and an eye exam or this and that. And I did all those things. And when I went for my eye exam, I told the doctor, the optometrist, I was like, hey, so at night when I'm driving, like, things get extra blurry. And he's like, oh, you just have dry eyes and astigmatism. It's fine. So he blew it off, so I blew it off. But apparently, neurological symptoms. Episodes of altered awareness. Functional seizures, also called dissociative or non-epileptic seizures. Blackouts and faints. These symptoms can overlap and can look like epileptic seizures or faints. Syncope. So, about 10 years ago, Tiff got diagnosed with anxiety-induced syncope. So I get stressed out enough where I make myself paint. See, there's one of those symptoms that I talked about where, confusing words, where I make myself paint, apparently, where I get stressed out enough where I faint. That is actually a thing that happens to people. It's a real life thing. I do it. I don't always do it. Usually I'm great in a crisis. It's after the crisis is done, my body goes, okay, crisis is done. poop. I'm just done. I faint. I'm done. The crisis is over. My body's like, okay, heightened sense of awareness, done and over with. We're safe now. We can go to sleep. Okay, we're going to go to take a dirt nap. I don't mean like under the dirt nap. I mean like in the dirt. Like face in the dirt now. I love that for me. Yeah. And I do tend to stare off and disassociate. But my favorite trauma thing to do is to overwork myself so that I don't have to disassociate. I always have something that I'm doing all the time. So there isn't enough time to think about nothing. Dizziness. Functional dizziness is often called persistent perceptual postural dizziness and has its own set of diagnostic criteria. So, the day before I went to the hospital, the first time, I was just in Walmart, my little cart, and I'm going, do, and I'm with my husband, and I look at him, and I go, I'm going to pass out if I don't sit down. And he goes, then sit down. And I'm like, I'm trying to find a place to sit down. There are no places to sit down. There's a really creepy guy standing over me. Oh, look, there's a bunch of diapers right here. And I sat down in the diaper section because I thought I was dizzy. Fast forward a little bit later into the day, we get to the event. The event is happening, and I can't stand to be in the sun, and it's not even that hot that day. I go to the like children's splash pad and get myself wet to cool myself off. It's not hot. My friend, then when we're on our way to the hospital, my friend says to me, Tiff, there's something suspicious about yesterday. Anyways, I knew that there was something wrong with you because you were not basking in the sun like a lizard. Because that's what I do. I am a person that lives for the sunlight. Give me all of the vitamin D. I wear sunscreen. I protect myself from the melanomas. I'm not stupid. Ingest the vitamin D, the natural stuff from the sun. And no, I did not do it that day because I felt like shit. And the next day I went to the hospital for the first time for all of this stuff. And then that whole week I was like, I don't feel good. I don't feel right. There is something wrong with me. And then finally I got the diagnosis of functional neurological disorder. Anyways, cognitive symptoms. Functional cognitive symptoms include difficulties with memory, concentration, or word finding. I thought that was just because of my ADHD. But no, it was not. It was literally the consistent buildup of this where I would literally just stand there having conversations with my clients while giving them haircuts, and I would just go, for really long periods of time and forget what the conversation was even about. Yeah. I think I burned myself out, possibly. I think that's what it really was. But here we go. We're going to go into what causes this. The exact cause of FND is unknown. Imagine that. Although ongoing research is starting to provide suggestions as to how and why it develops, many different predisposing factors can make patients more susceptible to FND, such as having another neurological condition, experiencing chronic pain, fatigue, or stress, childhood abuse, maltreatment or neglect, and life stress, particularly around the time of the symptom onset. I was under a lot of stress, but it wasn't stress from anybody else. It was literally stress that I put on myself because I felt like I had to solve the world's problems. Because I don't know, is also more common in people with FND than the general population. However, many people with FND have none of these risk factors, which is also unfortunate. Unfortunately common in all, including healthy populations. As with most complex disorders affecting the brain, it is likely genetic factors play a role in the condition, but it is not a problem that someone should expect to pass on genetically. At the time FND begins, studies have shown that many triggering factors like a physical injury, infectious illness, panic attack, or migraine can give someone the first experience of neurological symptoms. These symptoms normally settle down on their own. However, in FND, the symptoms become stuck in a pattern in the nervous system. That pattern is reflected in altered brain functioning. The result is a genuine and disabling problem in which the patient cannot control. I love that for me too. The aim of treatment is to retrain the brain, for example, by unlearning abnormal dysfunctional movement patterns that have developed and relearning normal movement. For seizures, the aim is to unlearn the seizure program that has become stuck in the brain and which activates typically with very little trigger and perhaps just in response to being relaxed. One way of thinking about FND is looking at a bit like a software problem on a computer. The hardware is not damaged, but there's a problem in the software, and so the computer doesn't work properly. A different analogy is a piano that is not broken, but is out of tune. Affected populations. The exact prevalence of FND is unknown. However, research suggests FND is the second most common reason for the neurological outpatient visit after headache and migraine, accounting for 1/6 of the diagnoses. This means FND could be as common as multiple sclerosis or Parkinson's. Ooh. Imagine that. FND can affect anyone at any time. Although it is uncommon in children under 10, FND is 2 to 3 times more likely to affect females than males. I wonder why. Is it because we're told that we have to behave in a certain way all the time? Girls are supposed to be sweet and nice and kind to us all the time. Although when patients present over the age of 50, it occurs equally in both groups. Disorders with similar symptoms. It is common for FND to coexist with other illnesses. FND can have similar symptoms to most other types of conditions seen in neurological practice, such as multiple sclerosis, stroke, and epilepsy. Some patients have other neurological disease diagnosis, such as stroke and FND. A neurologist is normally required to assess which symptoms relate to FND and to monitor where required for any new symptoms. Anxiety disorders and depression can sometimes cause physical symptoms which overlap with FND symptoms. For example, panic attacks can present with symptoms such as pins and needles in the fingers or mouth, and depression can often cause poor concentration or fatigue. Anxiety, panic attacks, and depression are common in patients with FND, but many patients do not have such problems. Other psychiatric conditions are more common in people with FND, including PTSD. I have complex PTSD. Go me. And emotionally unstable personality traits, often related to past trauma. Also me. There's also some emerging evidence that obsessive compulsive disorder and autism spectrum disorder, which I'm getting assessed for both of those, haha, and more common in FND populations and might predispose individuals to developing FND symptoms. Oh, look! Check, check, oh, check again! The call is coming from inside the house? Yes, hello? Why, yes. This is the textbook for FND? Why, yes, I would love to be included in your textbook definition for FND. That's cool. I would love to talk to you again later. Goodbye. I know, it's probably gonna fall short and nobody's ever gonna watch this video, but I don't care. I have to show off my stupid phone. Chronic pain is also common in patients with FND, including fibromyalgia. I don't have chronic pain, so maybe I'm not the textbook. Let me call them back. Just kidding, I'm done with the bit. Other functional disorders include irritable bowel syndrome, which I do have that, and overactive bladder symptoms. I don't have overactive bladder syndrome. There is some neuro research suggesting that joint hypermobility spectrum disorder, which includes Ehlers-Danlos type 3, may be more common in people with FND, which I really highly suspect I do have some form of Ehlers-Danlos syndrome. I did genetic testing. I have to wait another, I think 6 weeks before the results come in for that. And I did actual genetic testing with blood genetic testing. I don't remember which one. They took blood out of me to do it. It's important that new symptoms not automatically be considered FND. I am basically considering any symptom I experience part of my FND because I consider myself a pretty healthy freaking person for the most part. Until this, other than the shit that goes on in my brain, I'm fucking healthy. My brain is the only part of me that's messed up. And my brain isn't even messed up. My brain is pretty cool. I like all the crazy stuff that goes on up here. I like the thoughts that I have. Not the bad thoughts, because the bad thoughts are why I'm here. But my brain is a cool place. I have been able to think up some really creative ideas. I've been able to make some cool cosplays. I've been able to come up with really creative ideas for drag persona numbers, burlesque numbers. I've been able to cultivate these incredible friendships with people. I've got all this incredible knowledge of trivia that just floats around in my brain. I have been able to live the life that I've lived because of my brain, but my body not being cooperative with me, that's a problem. That's wherein lies my issue. So I think that I'm physically incredibly healthy. I don't think that I have, maybe there's other stuff that going on inside of my body that I don't know about. There's a possibility that I have Crohn's disease, but that's treatable. Ehlers-Danlos, treatable, I guess. Maybe that is a debilitating thing that I'm experiencing that I don't know about. But for the most part, I think that I'm an incredibly healthy person. So, I don't know. Thinking you're healthy, I guess, is different than actually being healthy. Yeah, functional neurological disorder. I don't guess I'm as healthy as I thought I was. I'll be one of your poster children. If you think this video is gonna help anybody else, yeah, well, I'll be sure to let them know to like and subscribe for more of this unhinged content. Well, I certainly hope they realize that I'm not always going to look this nice, and that when I get my official autism diagnosis that my content's going to be about that too. Hey, this is my journey. If they want to come along with it, I will link my Substack. I will figure out how to monetize a Patreon. I will get my friends to come on this YouTube channel so that they can talk about my ridiculousness with them. Okay, I'll share more of my weird medical shit. Thanks. Bye.